Hi there. It's Adam Murphy, and I wanted to finally talk healthcare. I had been hoping to have our renewal information for 2021, but I don't have that just yet, so I'm going to use our information for 2020. So what you see here is the healthcare plan for my business for Big Bang. And this is our current, or this was as of last year. Our premium is $10,852, and this was our healthcare. So $250 deductible, $750 the family, a 90-10 payout with $500 max out of pocket and $1,500 max out of pocket for a family. So we've literally got arguably the best health insurance that you can purchase. And as we're moving into 2020, this second column is our renewal information. And so you can see that for last year, we went up by 6.2%. Previous year, 0%, 1%. We've been perhaps as high as 11% since the ACA initiated, and we've had this kind of plan the entire time. Prior to the ACA, I do want to let you know that our rates went up anywhere from 26 to 42% a year. So this plan is not provided by the ACA. This is a normal plan through Anthem for our business. But our plans were definitely affected when Obamacare was announced and created. And so just for perspective, there are a couple of other renewal options on here. There's an option from Humana that's a little bit more expensive, $1,000 max out of, or $1,000 copays, $3,500 max out of pocket per person, $7,000 max per family. A United Healthcare one, $13,000 max out of pocket for a family, and one from WPS with $3,000 and $6,000. And you'll notice that those are all actually the United Healthcare isn't, but the Humana is more expensive, the WPS is more expensive by 32%, 17%. The UHC is 11.5% cheaper, but again, significantly more expensive for my employees at $6,600 max out of pocket versus our $500. So those are the decisions that I've got to make as a business owner, right? What makes sense for me and for my employees? And I will tell you that the reason that I do this is because I believe both in social benefits as well as capitalistic benefits. To have a scenario where my employees, and for example, we've had 5 children born in the last 3 years here at Big Bang, which is amazing, and nobody has had to pay more than $500 out of pocket per individual. If we are on one of these other plans, some of those people could have been looking at tens of thousands of dollars worth of costs associated with having their children. And I think that's a tragedy. So the advantage of this program for my employees, again, $250 max out of pocket, deductible, is it gives my employees a tremendous sense of security. They know that if something happens, that they can go to the doctor. They know that if they're sick, they should stay home and not infect the rest of the office. If their kids get sick, they know that they can take them in and everything's covered and that it won't break the bank. If I look at this Humana one, which is a 0%, which is terrific, but a $1,000 deductible, $2,000 family, $3,500 and $7,000. All right, I've got people making $50,000, $60,000, $70,000, $80,000, and that's not bad by any stretch of the imagination. But say you're making $50,000, a $3,500 hit is not insignificant. A $7,000 hit is going to hurt, let alone $6,000 or $13,000. And again, these are really good plans. So one of the challenges with the ACA is understanding how this math works for them. And so let me pull up for you. These are our individual coverages, and I've taken out my employees' names. But what is important about the ACA versus regular insurance is that if you look at this, so we've got a family of 3, male 49, his 50-year-old wife, 15-year-old child. Their rate, $2,150 a month. Okay. Let's look at this one. So here's a female employee, single. She actually had a baby, so she's no longer covered with, or she would have the child under here. But at 33 years old, her cost was $771. Now look at this. We have a male at 35 at only $440 a month. So the reason for that is that when we look at actuarial tables for insurance, and normally I get these from Anthem, and it's really interesting to look at, but young men cost less than young women, and that's because, of course, young women are at a point where they can't have children. Again, we had 5. So because of that, the actuarial tables, the rates that they're going to charge for young women are more expensive than they are for young men. Now, look at this one. This is a female, 61 years old, $1,559 a month, versus female at 33, $771 a month. So twice as much. So age has an impact. The greater the age, the more expensive, because generally speaking, of course, as we get older, we tend to have more problems. And what will happen is that those will cross at some point where men become more expensive than women. Men, as they get to around 50, become more expensive than women because we then have prostate issues and that sort of thing, where women generally have fewer issues. They're healthier as they grow older and less likely, of course, to have children. So it's interesting to take a look at this data. Here's a family of 4, 39-year-old male, 38-year-old female, and there are 2 kids, $2,000 a month. Well, family 49, 50 years old, and 1 kid, 2150. So we can get a sense of what children cost, but age definitely has a factor. Here's the restriction in the ACA for programs set up and plans set up through the ACA. Is they eliminated male and female as part of the actuarial tables. So we can't look at the 35-year-old male versus the 33-year-old male and say that she's going to be more expensive. Instead, they would average these out, and we might both see $550, $600 a month. Well, obviously for the 35-year-old guy, that's more expensive than what he's been paying, or potentially, depending on the situation. So when some people say that their rates go up under the ACA, in part that's because we're balancing out male and female. The other thing that they did is they established that there are only 3 tiers for ages. On this particular one, and again, I apologize, I don't have all of the data, but it was by 5-year increment. So every 5 years they went up, but more gradually. Well, in the ACA, because there's only 3 tiers, and the other thing that they did is, I believe that there's a restriction, and somebody can correct me if I'm wrong, but I believe there's a restriction that the highest age tier can only be 3 times the cost of the lowest tier. Well, $1,559 for a 61-year-old woman and $440, so that's almost 4 times, 3.5 times, right there. So it skewed some of those numbers again to try to balance things out a little bit. And that was the point of the ACA, is to work on balancing out some of that to bring healthy people in, and that's the requirement, to bring healthy people in that aren't going to cost as much, which kind of offsets the more expensive people, whether it's for health issues, age issues, pregnancy issues, accidents, health, whatever it may be. So there's an awful lot going on that if you've never seen these numbers behind the scenes, doesn't necessarily make sense automatically when it comes to the ACA. Now, I want to talk about one other thing about the ACA, and then I'm going to get a little bit more into healthcare. Part of the challenge that we have here in Wisconsin is Governor Walker, when he was in charge, and the GOP, chose not to accept the revenue from the federal government for the ACA to expand Badger Care, to expand the state Medicaid. And their argument for that, and I disagree with it, was, well, we don't know if that money is always going to be here, so we don't want to provide a service and then have to take it away. And that's understandable. But the reason that they didn't know if it was going to be there is because Paul Ryan and the GOP in D.C. voted over 70 times to defund the ACA. So here's what that did. First of all, it was $200 million a year, which would have started in 2013, if memory serves. And again, please excuse me if I'm incorrect on that. Feel free to correct me. But that means $1.4 billion that we have not received in the state of Wisconsin. The other thing that it would have done is Badger Care is for those families who are at the poverty level, which I believe is around $13,000. And what it would have done is it would have expanded Badger Care to 1.5 times that, to about $19,000. Now again, $19,000 is not a lot for a household income, I don't think. $1,500, $1,600, $1,700 a month. But it would have impacted tens of thousands, if not more, and again, I apologize, I forget the numbers off the top of my head, but tens of thousands of households would have been covered in Wisconsin. And that would have covered 90% of the cost associated with Badger Care, which means that health care overall would have been cheaper, would have been less expensive for all of us because of that $200 million, while also covering tens of thousands more households. The other thing that happened is because Wisconsin chose not to participate, Wisconsin and Governor Walker decided not to create a Wisconsin insurance exchange. So that's where local Wisconsin companies would have participated, and some of that money and that revenue would have gone towards those organizations as they provided insurance plans. Wisconsin chose not to do that. Consequently, there were fewer participants in that plan. So, if we want more competition from insurance companies, if we want to lower rates, okay, and we took a look back here at how rates can be dramatically different. If we want more competition, that would have happened if we had created a state exchange. Instead, we didn't. So there are some counties in Wisconsin where there is one insurance company that's part of the ACA. Well, that's not competition. That's a monopoly. So they get to charge more. So again, there's a tremendous amount that goes into all of this, but part of the problem that we have in Wisconsin, part of the challenge, is that this was politics. This was not economic decision making. This was not decisions made in the benefit for our voters, for our citizens, for the kids and the families that live here. This was pure politics and nothing more, and it has cost us all dearly. Now, you're going to say, Adam, you're a raging liberal. I get it. Sorry, or a radical liberal, as they call me. I'm not. I believe in economics. I'm a capitalist. I want to make more money. The reason I provide this plan, the other reason that I provide this plan, is my employees are more dedicated to me, to the business, to their customers, to each other. I have incredible employees, in part because of this plan. Because they know that they are safe, they know that they are well taken care of, they know that they are appreciated. That benefits me as an employer. That makes me more money. I'm a capitalist. That's my goal. But we can do it while also benefiting society. So let me talk about some of the challenges and problems with health care, health insurance overall in the system. You're going to look at me and go, oh, he wants to do Medicare for all. I actually don't. I don't necessarily agree with that plan, and there are several plans that are proposed out there, and we can talk about it. Medicare for all may be the final solution, but the challenge, the problem that I see with Medicare for all is it doesn't necessarily address the core problem. It kind of, pardon the pun, puts a Band-Aid on it. Here's the core problem. So this is a surgery that I had on my thumb in January this year, so the billing was from March, and these are my bills. And what you'll see is, here's my hospital charges. Now, this was a 40-minute surgery where they numbed my thumb. I have a small Y, maybe 3/4 inch incisions. Took about 40 minutes. They numbed my thumb. The surgeon in there, a couple of other people to handle the anesthesia, and a nurse. 40 minutes. $11,635. Now, when I walked in the door that morning at 5:30, to sign all the paperwork, I was told this. So this is part of the new requirements associated, and again, I'm not sure if it's with the ACA or if it's here at the state, but to provide the patient the information about their billing before they go in. So I was given a document to sign saying, this is going to cost $11,635. Your insurance will pay for it, but if not, here's the balance. So here's what my insurance paid, $1,809. Now that's because Anthem has a deal, a contract associated with this particular hospital for these particular services. And because I had already paid somewhat into my deductible as I had gone in to meet with the surgeon and some other things beforehand, they paid $1,778. I owed another $31 for this $11,000 surgery. They received $1,800. Now here's the problem. If I did not have insurance, I would be responsible for $11,635 for that 40-minute surgery on my thumb. I'm not denying the validity of the billing. I'm pointing out the very obvious problem that we've got between those who are fortunate to have insurance and those who do not. And keep in mind, I have the best insurance that you can, almost the best insurance you can buy. Somebody that had lesser insurance would have wound up paying more. So say you had one of those $3,000 deductibles. Well, you would have been on the hook for $3,000. I don't know, quite honestly, whether Anthem would have gotten more or less. That's per every individual contract, all right, and every plan. So those decisions would have been made, between the insurance companies and the hospital. I don't know how that would have played out, but I suspect the hospital may have been paid more. But if you don't have a job, or if you have very poor health insurance, or say over the summer when unemployment spiked at 16%, you could have done COBRA. However, COBRA, if you've heard about it, COBRA is paying your premium. So you keep your health insurance, but you have to pay the full premium. So tell me how a family of 3 that's out on unemployment is going to pay $2,100 a month. Yes, there was the $600 a week bump from the federal government, so that certainly would have helped. But 70%, 75% of their income, which is also taxed, would have gone only for health care. So that's part of the problem that we're dealing with here. Is it's not simply transparency. It's not simply prices rising. It's the overall system. And that's why I say Medicare for All may not necessarily be the solution. Perhaps it will be in the end. But we need to delve into and deal with these problems, because somebody that gets an $11,000 bill that has a $40,000 job and a $5,000 deductible is going to be in a world of hurt for this. This is going to be on their credit for a long time. They are going to be hassled for this because they're not going to be able to easily pay it. 42% of the people in the country make $15 an hour or less. I'm not going to delve into minimum wage right now, but $15 an hour is $30,000 a year. 42% of the people in this country, if they are working full-time at that job, make $30,000 or less. They do not have the kind of health insurance that Big Bang is providing. They have health insurance where they are going to wind up paying thousands and thousands of dollars for a 40-minute thumb surgery. That doesn't make any sense. It's a bad use of their money. It's a bad use of our money as a society. It's bad for business. It's bad for economics. It's bad for the economy. It's terrible for all of us. So when I ask the question, do we want universal health care? I'm not necessarily talking health insurance, and I certainly am not suggesting that the government should take over health care, not by any stretch of the imagination. What I am suggesting is that we have some level of basic health insurance that covers everybody at some level. Might that come from businesses? Perhaps. Businesses already pay unemployment tax. So when people are getting unemployment, that's already a tax that every business has paid into. I, as a business owner, you just saw my numbers. I'm not opposed to the idea of not paying out $11,000 a month just for my employees. If I paid out $9,000 a month and it went into an overall pool that balanced out and benefited people across the state of Wisconsin, it would cost me less. It would give me an opportunity to hire other employees, right? Because one of the challenges is if you do have good health care, if you do have those benefits that matter to you and your family, you're kind of stuck. It limits your options as to where you can go and what you can do if health insurance is an important part of your reality. I'm going to drop the last 2 things on the ACA on you, and then I'll let you go after this very long video. So the last 2 aspects of the ACA, we taught one of them you hear about all the time, and it's something that's being fought right now. It's up at the Supreme Court whether the ACA is going to be overturned, and that, of course, is pre-existing conditions. Obamacare and the ACA established that pre-existing conditions cannot be a caveat for insurance companies not to cover you. If the ACA goes away, which is what the Republicans have been trying to do at the state level and the federal level for 10 years, that goes away as well. So if you have an existing health situation, you may no longer be covered, or your coverage may be significantly more expensive. There's math behind it. right? We understand it. I talked about the actuarial aspect of things. I'm not denying the math behind it. But we now have 8 million people in this country, I think it's up to 8 million, that have had COVID, and we don't know what those long-term effects are going to be. Will insurance companies cover you in the future if you have lung problems, pre-existing conditions are not covered, and it's discovered that you were diagnosed with COVID? I don't know, but my suspicion would be no. So that's one aspect. The other aspect, and this is where I want to talk to the 26 and under group, and I want to talk to parents of that age group. Obamacare and the ACA established that insurance companies have to cover children up to the age of 26. Prior to that, 18. Once you're an adult, you are out. So if you're in college and you are covered by your parents, that's because of the ACA. And if you are a parent and your children are covered through their college years and perhaps even after that, especially if they're in their mid-20s, have kids for the first time, something along those lines, that is simply because of the regulations in Obamacare. That is because of the ACA. Without that age group from 18 to 26 would most of the time not be covered by significant health care, by health insurance, because they can't afford it, and they're really expensive, especially, and I mean no offense, but women in particular, because of the possibility of getting pregnant. So those are the things that we are fighting for. Those are the things that I am fighting for. That is why I would love to see some level of universal health care, whether at the state or at the federal level. But most importantly, what I want to see right now, what I want to see our senators and our assemblymen do is accept the $200 million a year from the ACA to cover those people who are most in need, making less than $19,000 a month or $19,000 a year in this state, and help our employees, our friends, our families, and our businesses all be healthier. That's what makes good economic sense, and at the same time, it makes good social sense. Thanks so much for listening. I know this was a long video. Take care.